Welcome to the NELFT donning and doffing demonstration video. I've got my colleague Nicola, Infection Control Specialist Nurse, with us today, and I'm going to ask Nicola some questions because, like me, you're probably confused. There's a lot of stuff and I'm not 100% clear about what to wear when. So, let's not waste a moment. Nicola, there's a lot of stuff on the table.
There is indeed.
I mean, do I just wear what I like, or is there like a...
No, we have to follow the national guidance from Public Health England. We have a number of things here that explain about donning and doffing. These are all on the intranet. So if you could possibly read these, that would be great.
Okay, and I can get these on the NELFT intranet?
Yes, they're on the NELFT, and they're also, if you can just log on to the PHE website, and they're all on there as well. So you can print those off. But the different items we have here is we have the different types of masks. So this is your normal fluid-resistant surgical mask.
And it's got loops.
It has. One of them's got loops and one has got ties. The ties are used on the community wards or out in the community due to the ligature risk in mental health.
Right.
The ones with the loops are used on the mental health wards. Okay. So you would use those for most of the procedures. For all, the only time that you wouldn't wear these ones would be if you were doing an aerosol generated procedure such as suction, like with a trachea, and then you would wear an FFP3, which is, there's different types. There's two, on the table here there's two different types. You would have to be trained to wear these. And you'd have to be fit tested to make sure that the fit is correct for you, because everybody's face is a different shape. So some people this won't suit, some people that won't suit. So just to determine which is the best mask to wear.
Once I'm fit tested and trained,
yeah.
And let's say this particular mask is the one that I'm trained on and it fits me, I can't wear that one?
No, you can only wear that one. If you wanted to wear a different type of mask, you would have to have the fit testing again to make sure that you're safe to wear that mask.
Okay. And is that training available across NELFT?
Yes, we have train the trainers, so all your areas should have a train the trainer. We have the kits, so if you contact them, they should be able to do some training with you. If you don't know who the trainers are, if you contact the infection control inbox, and then we'll let you know who the trainer in your area is.
Thank you, that's useful.
These are the gowns. You would wear these during the aerosol generated procedures, two different types.
Okay, can't just wear these for a normal visit?
No, you would need to wear just the normal white apron, because you should all by now have scrubs or a uniform. Yeah. So these are adequate. Okay. So what are these? These are the hair nets. We now the PPE orders now have the hair nets are available, so you can wear these if you choose to. Okay. You don't have to, but that's a choice if you want to wear them.
And obviously, I know what these are. They're
gloves.
What about this?
These are shoe covers. These can be worn when you go into people's houses when you're visiting someone at home.
Okay.
We also have seat covers for people who are seeing people in their own homes, so they can put a seat cover in their car to protect their car.
Oh, that's amazing. And what about these? Do we wear these?
Yes, these are worn. If you're doing an aerosol generating procedure, you would wear eye protection.
Okay.
Okay, but in all other circumstances, you would have to risk assess. So if you think there's a risk that you would get splashed into the eyes or the face, then you can wear one of these. These are single use. They need to be disposed of afterwards.
Okay.
We did have some non-disposable ones that we were cleaning, but now we have only the disposable ones.
Okay, thank you. And what are these? I know there's a lot of different wipes.
Yes.
Where am I supposed to use those, and what are they for?
Well, we're recommending that you use Actichlor Plus on the wards. So inpatient areas should be Actichlor Plus. It's a chlorine base, and that will that kills everything. What is difficult about that in the communities is it's in liquid form, so it's not easy to take out with you. So we're saying if you use detergent wipes, they're used on equipment and things like that. So all equipment that you take into the house, if you clean with a detergent wipe.
Okay, so my syringe drivers and things I
Yeah.
can clean with these.
Yeah.
Okay, and of course these antibacterial surface wipes.
Yeah. Actichlor Plus can actually be quite damaging too.
So if I'm preparing like perhaps an injection in a patient's home, I could clean down with these first?
The only problem is because they come in big tubs, it's quite difficult to take it in.
Right.
So you could just use a sterile field.
Did I ask you about the gels? I prefer these, but sometimes I'm being presented with these.
Yes, well we're recommending that if you're ward-based, because you've got access to the proper hand wash sinks, that you wash your hands. In the community that can sometimes be difficult because the houses you're going into you might not be able to wash your hands, so we would recommend that you use gel, but then as soon as you possibly can, in a clean, safe area, you can wash your hands. Your gel that you can take into people's homes, you can have this and leave this in your car and use that in your car.